symptoms of chronic posterior urethritis and prostatitis. Chronic posterior urethritis and chronic prostatitis can rarely be distinguished from each other. Indeed, chronic posterior urethritis is clinically synonymous with chronic follicular prostatitis. On the other hand, chronic prostatitis may not be complicated by chronic urethritis. 30% of 280 cases studied by Young. Footnote, i.e., the prostate may contain pus, but the urine be free from pus and shreds. Hence, it is preferable to consider chronic posterior urethritis under the title of chronic prostatitis. The symptoms of chronic prostatitis are much the same, whether caused by the gonococcus or not. If gonocoxic, the inflammation is more likely, either spontaneously or as the result of massage or urethral instrumentation, to light up an acute urethritis, while non-gonocoxic or post-gonocoxic cases sometimes flare up in the shape of vesical bacteriuria. Hence, it is clinically preferable to group all cases of chronic prostatitis, whether gonorrheal or not, under one head. In our series of 358 cases, no etiology was obtained in 53 cases, 14.8%. There was a history of gonorrheal urethritis in 262, 73.2%, of masturbation in 27, 7.5%, of prolonged sexual excitement without coitus in 4 cases, and withdrawal in 3 cases, 2%, of descending infection in 3, 0.8%, of traumatism, bicycling twice, in 3, 0.8%, of instrumentation in 2, 0.6%, of infectious diseases, grip, in 1 case, 0.3%. When gonorrhea had existed, that was accepted as the cause of the prostatitis, although in some of these cases, abnormal sexual practices may have played an important role. The symptoms of chronic prostatitis are classed by Young as urinary, referred, and sexual. Footnote, in their study of chronic prostatitis, Young, Garrity, and Stevens have attributed to this malady certain symptoms, e.g., renal colic and pain in the rectum, characteristic of vesiculitis. For this reason, the detail of symptoms given by them has not been precisely followed. The urinary symptoms are urethral discharge, disturbance of urination, mechanical obstruction to urination. The referred symptoms are reflex pains and abnormal sensations. The sexual symptoms are disturbance of the sexual function, spermatorrhea, and prostatorrhea. Urethral discharge. Urethral discharge is a symptom of anterior urethritis, yet persistent urethral discharge is the symptom that usually brings the victim of chronic prostatitis to the physician. Moreover, such urethral discharge can be cured only by treatment of the prostate. In the average case, therefore, chronic prostatitis is accompanied not only by posterior urethritis, but by anterior urethritis as well. Disturbance of urination. Urination may be normal, frequent, painful before or during the act, urgent or difficult. The stream may be slow to start or slow to terminate. None of these symptoms is absolutely characteristic of prostatitis, nor can one infer the pathological process present from a consideration of them. Obstruction to urination. Obstruction to urination, though a rare result of chronic prostatitis, may nevertheless be the most important feature of a given case. The obstruction is due either to an enlargement of the median isthmus in the form of a bar or to cicatricial contraction of the vesico-urethral orifice, i.e. stricture, contracture of the neck of the bladder. The symptoms are those of prostatism occurring in a young person. The prostate is usually not enlarged, as felt from the rectum, page 289. Reflex pains and abnormal sensations. The abnormal sensation excited by chronic prostatitis may be a pain, an itching or burning sensation, or a sense of fullness. It may be constant or intermittent. It is rarely very severe. It may or may not be excited by a full bladder or by the passage of urine. The majority of patients with chronic prostatitis suffer little or no discomfort. The abnormal sensation is always referred to some point on the surface of the body. The sensation may be felt at any point below the navel, even as far away as the foot. But the characteristic pains of prostatitis are pain in the back, in the perineum, above the pubes, along the urethra, in the groin or testis. Certain of these pains merit a word of description. Pain in the back. The pain is usually in the upper sacral region, constant and aching in character, uninfluenced by urination. Pain over the kidneys is rare. Pain in the perineum. The perineal pain is usually so mild as to be little more than a sensation. It may or may not be influenced by urination. It is often associated with a peculiar sense of fullness in the perineal body or with a peculiar irritability in that region, excited by continued pressure against the perineum. The patient who suffers from this symptom cannot sit still for any length of time, though, as a rule, he prefers a hard seat to a soft one. He is debarred from the theater and the church, and on the railroad he either sits obliquely on one hip or paces the aisle. Pain along the urethra. 2 spots along the penile urethra are especially subject to referred prostatic sensations. These are 1, a point just behind the glans penis, and 2, the penoscrotal angle. Many patients are obsessed with the belief that all their trouble lies in one or other of these spots, whereas the sensation there is a characteristic sign of trouble in the deep urethra and prostate. Disturbance of the sexual function. Premature and painful ejaculations, incomplete or painful erections, nocturnal emissions, and every other symptom of sexual neurasthenia occur in persons whose prostatic fluid contains more or less pus. They are sensory disturbances due to pathological changes in the verumontanum, the utricle, or the ejaculatory ducts. These symptoms are rare in patients with severe prostatitis. They are fully as common in patients who have not had gonorrhea as in those who have. Prostaturia and spermaturia. Like the functional disturbance noted in the preceding paragraph, prostaturia and urethraria are usually functional sexual disturbances only accidentally post-gonorrheal. Page 188. Symptomless cases. It is not to be forgotten that many cases of chronic prostatitis produce no symptoms.